Good evening, everyone. Thank you all for joining us tonight on a special webinar that will be presenting information and updates on aesthetic medicine for the millennial patient. I am a board-certified dermatologist, associate professor at dermatology department at University of Miami Miller School of Medicine. It's my privilege to be here tonight, along with my colleagues, Dr. Paul Laurence and Dr. Omar Ibrahim. Tonight, we'll be sharing with you a lot of practical pearls on how to treat the needs of aesthetic patients, particularly focusing on millennial patients and Gen Z patients. So as you probably have experienced in your practice, there is a huge surge in the aesthetic needs of younger patients, particularly in the past few years. We have witnessed a lot of changes in our aesthetic landscape. But in the past few years, particularly during the pandemic, we are witnessing a huge rise in the needs of aesthetic procedures among younger women. And you probably have seen headlines similar to these, calling out Zoom boom in cosmetic surgery or the Zoom phase as reflecting the rising needs in younger patients as patients are becoming more self-aware of their physical appearance. They're more interested in self-care, and they're taking advantage of time off as they're working from home. But as we're moving away from the pandemic, we don't see any slowing down of cosmetic needs in the younger patients. In fact, surveys from several professional organizations, including the American Society of Dermatologic Surgery, American Academy for Facial Plastics and Reconstructive Surgery, and American Society of Plastic Surgeons have confirmed that there's only going to be a continued increase in both invasive and non-invasive procedures in the US and worldwide. And the millennial takeover continues, such that in the past year, in 2021, older patients or those aged 56 or older actually are representing a lower percentage of overall procedures in the cosmetic arena compared to younger patients. There are also been a rising trends towards more gender-balanced procedures as we are becoming more inclusive as an industry. And social media has emerged as a key marketing platform in cosmetics. So tonight we'll be focusing on the millennial patient. Who are the millennial patients? So those are usually patients in their mid-20s to late 30s or early 40s. They're born between 1981 to 1996. While overall, millennials are considered to be economically slightly disadvantaged with more student debt, lower income compared to baby boomers, but they do outspend baby boomers by at least 2-to-1 ratio in the self-care industry, according to studies. And that includes skincare and cosmetics. And worldwide, millennials are also more likely to consider preventative treatments compared to any other age group. And they're heavily influenced by social media. And while there is being a lot of increasing demand for aesthetic in the millennial patients, the literature in this area is actually quite young. Only a few studies been published in the past few years focusing on this special population. A more recent study found that according to data from a single practice, the most common procedure requested by millennial patients were neurotoxins, followed by vascular laser. Similar trends have been found by a most recent survey by American Society of Plastic Surgeons. So in addition to neurotoxin, millennial patients are also very much invested in soft tissue filler and non-invasive fat reduction. And interesting, when you look at this bar graph demonstrating the distribution of patient age across various non-invasive and invasive aesthetic procedures, you can see those aged between 31 and 45 comprise the majority of patients getting soft tissue filler, or neurotoxin. But interestingly, when we move down to lip augmentation or lip filler, even younger patients make up the majority of consumers. So here we can see an overwhelming majority by patients younger than 30 for lip filler. So these trends are clearly dynamic, changing over time, and they're also driven by social media. This meme actually really illustrates the power of social media, how it has transformed the current beauty standards on what's considered beautiful. And social media includes some of the major platforms that we're all very familiar with, such as Instagram, Facebook. The younger patients, especially Gen Z, are more heavily interested in TikTok and Reddit. Some other consumer-driven online sites, such as Real Self, also contribute to social media marketing in the aesthetic industry. What's interesting about social media is that both providers and consumers can become influencers. So the contents you produce on social media can really build your career and become a very powerful tool for you to build your practice. Social media has also helped to increase the wide acceptance of cosmetic procedure in the general public, as we are witnessing transformation of our favorite childhood celebrity or influencer in front of our eyes over time. So with social media and increased interest in cosmetic procedures, tonight we'll be sharing with you key anatomy knowledge and product selection, as well as injectable pearls with a focus on procedures that you may see requested in your younger patients, ranging from brow lift, lip flip, baby Botox, to lip filler, to jawline contouring. These procedures are very valuable in the sense that they can attract patients to practice and help you to retain patients and really expand your aesthetic practice over time. Along with sharing with you knowledge on anatomy, product selection, and practical pearls, we'll also be sharing with you how to optimize your injection techniques as well as aesthetic practice to target the younger patients, particularly focus on those patients coming in requesting pre-rejuvenation. So it's prevention and rejuvenation. So as you may see that in younger patients, certain classical procedures we do as aesthetic injectors, such as lip filler or tear trough filler, they're not necessarily absolutely needed in these younger patients, but they're coming in requesting these procedures because they want to get ahead of the aging. They want to be proactive in aging. They want to look fresher. They want to wake up looking like filtered, and they want to look rejuvenated. So it's important to understand that younger patients are very much interested in pre-rejuvenation, not just a rejuvenation, especially nowadays with social media, with influencer celebrity culture. We're seeing our favorite childhood celebrities have aged very slowly or gracefully over time. And the concept of combining minimally invasive procedures to slow down aging has really a wide appeal, particularly in the millennial patients. But of course, it's a slippery slope where sometimes we may see results like these on social media, where a certain procedure is done too much, where there's too much of exaggeration of certain trends. This is where trends become fads. And as aesthetic providers, we also have a responsibility to maintain that balance between pre-rejuvenation, beautification, and prevent exaggerated cases like these. Definitely not something that we want to be known as. And in addition to pre-rejuvenation, you may notice there's a subgroup of younger patients. They're more sophisticated. They're looking for beautification. So in addition to slowing down aging, they want to look better. They want to look a little bit brighter. They want to look perkier. So here, with a combination of neurotoxin procedures, dermal filler procedures, and non-invasive energy-based devices, we can really beautify a person's appearance by creating more harmonious facial features, more dramatic highlights, shadowing, while still maintaining appropriate beauty proportions. And lastly, tonight, we'll be sharing some procedures that help you to make transformations in your patients. So here, we're actually seeing a rising increase in younger patients. They want to change certain aspects of their facial features, not just beautification or pre-rejuvenation. They want to have a different, more harmonious appearance. So here, by combining multiple different treatment options and staging them over time, as aesthetic providers, we can significantly transform a person's physical appearance by creating more proportion, more balance. And over time, these results can give patients a dramatic transformation while still maintaining a certain element of their unique beauty feature. This is where we can set ourselves apart and incorporate the art of aesthetics with our skills and knowledge, anatomy, and product selection. So tonight, we will have three very exciting subsections on anatomy, product selection, and injection technique. And we'll be focusing on procedures and techniques that can help you to optimize your treatment and servicing of a more diverse, younger patient demographics. And we also want to emphasize that we're all here tonight because we're all interested in learning new innovation, learning new techniques, and try to incorporate these newer techniques and innovation or new products will help you to stay ahead of the game in this very competitive environment, but also very exciting environment of aesthetic medicine. So tonight, we'll first start with Dr. Paul Lawrence on aesthetic facial anatomy, followed by Dr. Omar Ibrahim presenting on aesthetic product review. And I will present some practical pearls on injection techniques. And we'll finally get together, do an interactive panel discussion to answer questions and share some pearls on practice management issues that can help you to optimize and retain millennial patients in your aesthetic practice.